Well, certainly I think the idea of making an opioid safer is very desirable, and the current approach has been to address certain components of the way that these drugs are abused. But I think the overall intent is to try to create products that are abused in all segments if possible. And there's a variety of ways they've kind of laid out a path to hopefully accomplish that. Most of the products we have currently are really focused around ways that people abuse them through nasal snorting or through injection. But the engineers are hard at work, I think, to try to come up with new technologies to really hopefully improve the safety of these and keep these medications available for those patients who really need them. So we have technologies that resist crushing. So if a patient or a recipient or somebody who seeks this type of medication through illegitimate pathways, the hope is that they won't be able to powderize it and then snort it or inject it. So there's ways that are making the tablets more difficult to manipulate. Some tablets are added with gelling agents so that the products will form a substance that's not easy to snort or inject. We have drugs that have antagonists within them that can be released upon manipulation and therefore either reduce the euphoria or the desirability of the products. We have some irritant substances that can just make them less desirable for people to manipulate and overall abuse. Well, I think we're heading in the right direction. In my program, I'm going to make some parallels to the auto industry in that there was an increasing number of motor vehicle fatalities starting in the early 1900s when cars started. People immediately had accidents and traumas, and that was escalating over the years. And the industry and the automakers started to introduce technologies such as brake assist and seatbelts and airbags and crush-resistant zones and third lights, and all of this technology is really important, and actually a downturn was seen in the number of motor vehicle fatalities as these technologies were rolled out. What I think is an important parallel, though, is that these technologies in the auto industry are not replacing the fact that we still need to pick people who can operate vehicles safely, and they don't stop vehicles from crashing. So they still allow for some measure of safety, and I think that's been borne out in their industry. But you can't have drivers who are impaired, and drivers can still crash into each other, and people can still die. You also can't have other people operate these vehicles that are not appropriate, like the kids or if they're not licensed or somebody else. The technology in terms of the opioids, I think, are moving in that direction as well, that the industry is doing what they can do on their end to engineer products that are less manipulatable and less desirable. It's very important, though, that we as healthcare professionals remember that we still have to pick the right patients to provide these products to, that our patient selection still is paramount, and we have to take into account the whole patient assessment process and risk stratification when we're utilizing opioids of any sort. So although these technologies exist, they don't replace our responsibility in patient selection. It is not just the exposure, and the problem is not simple in its solution. That this is a complex situation that we have. We have people with pain, we have people that seek our medicines for abuse, and we have addiction, and this is unfortunately not easy. We've not even universally defined what it is we are trying to change in this system. We know that we want to reduce the abuse, misuse, overdose, and harms, but that's a big amount of information, or a big pool to try to change. It's hard to know how the impact of what we're doing has on that change.